So, hey guys, good day to all. Myself Ajay Moria. Today I'm going to continue our discussion of our 150 short. Okay, last video at the part 10 we discussed until the here congenital heart defects. Right now we are going to continue from there. Okay, so this is our topic. Topic today is for the PDF guys. Please use the latest one. It's already in our group. Okay, the Telegram, but the PDF is link in the group. Okay, so right now we are going to continue discussion here. Okay, here next one is the differences between the Bore-Off syndrome and the Mallory-Weiss-Stare. Okay, so how they are going to ask these questions in the exam is that they will give one case scenario about this one. In these two syndrome guys, in these two scenarios, they will give the history as what? Both history as there is a chronic alcohol drinker. Okay, a chronic alcohol drinker. But you have to remember that one, in the Mallory we state there is going to be fresh blood. What is going to be fresh blood vomiting. Okay, fresh blood vomiting. Fresh blood vomiting. And this is going to be a self-limiting. Remember what is the most common site here? It is the gastroesophageal junction. It is the okay now. Okay, and there is a what type tear? There is a longitudinal tear. Okay, but here there is also they will give the history as the what forceful vomiting. This is as he also a binge drinker. There is a forceful vomiting and also it will shows the symptoms of the lower GI. Okay now he's the most common site is the what lower 1/3 GI. Here is the lower. Okay, upper GI. This is the lower GI. Okay, apart from one guys, there is going to be a Meckel's triad. That is here we have the chest pain, vomiting and retching. There is a what subcutaneous emphysema also. In the X-ray, we will see the continuous diaphragm sign. It meaning there is going to be a perforation. Okay, so this is going to be the medical emergency. So you have to admit the patient and do the thoracotomy and do the medication lavage and you have to close the perforation. Okay, that's it from the here. Remember the Meckel's triad is seen in Bora syndrome. In the Mallory-Weiss tear, there is no Meckel's triad, but only the small things. Okay, it is self-limiting. No need to do any interventions. Okay, next one. Next one, you have to remember the some side effects. Okay, na? You have to remember the some side effects. Okay, na? The specs for the lighting. Okay, na? Here you have to remember always the lithium is very important. Lithium is very important. Most commonly we are using the lithium is the what? Lithium carbonate. What is the lithium carbonate? We are using the lithium carbonate. COC3. Sorry, okay, na? COC. They are going to ask a question: what combination lithium we are using? We are using what? Lithium carbonate 300 milligram. How much? Lithium carbonate 300 milligram. Nowadays we are using for the what? For the bipolar. It is a mood stabilizer. Okay, na? So the patient who are taking the lithium guys, they will have these symptoms. Okay, na? They may be having the lithium side effects. L for leukocytosis, I for insipidus. There is a diabetic insipidus. Okay, na? This is the most common. This is the most common type of manifestation. T for tremors, fine tremors. H for hypothyroidism, E for I for increased weight, U for stomach upset, and M for malformation. That is Epstein anomaly. You have to always do the serum lithium monitoring. Okay, na? If it is more than 1.5 to 2, then it is going to be severe toxicity and need the hospital admission. Okay, na? Next one, amiodarone. Okay, na? It is used for the what? To control the rhythm. Okay, na? They will ask you the what are side effects of amiodarone. Everyone knows this one. It is the brown man syndrome. P for pulmonary fibrosis. This is there's one mnemonic, okay, na? I don't know, I can't remember the mnemonic, but you have to remember the other side effects: pulmonary fibrosis, corneal vertical microdeposit, blue color skin, myocarditis, QT prolongations. These are all the side effects of the metron. Next, you have to remember the therapeutic monitoring is done for lithium, phenotine, digoxin, heparin, and theophylline. Remember, this is the disulfiram reaction. Okay, na? Disulfiram like reaction. This is the disulfiram like reaction. What is disulfiram? Disulfiram, it is it is the irreversible. It is acetaldehyde dehydrogenase inhibitor. Okay, na? If this disulfiram is given to avoid the, it is given in the case of chronic alcohol patients, so that if you give this disulfiram gas, then what happens now? Whenever the patient is try to take this alcohol, okay, now whenever patient, for example, this is the one patient, this is one patient, he is a chronic alcohol, okay, now then you have to tell the patient that, okay, we are going to use the stop stop stop. So for example, this is a patient, okay, na, he is a chronic alcohol drinker, and he came to you in the OPD, okay, na, he was in delirium. He don't know what is happening. First of all, what you are going to do? First of all, you have to admit the patient, and you have to start with the injection thiamine plus, and also injection lorazepam. First of all, for the first 2 to 3 days, you have to do this one. First of all, you have to detox. You do the first of all, you have to detoxify the everything. Then after that one, you have to take the consent from some patient that we are going to start the disulfiram, which is going to be whenever you are going to take this tab. After taking this tablet, whenever you are going to take whenever you're going to take the drugs, or you're going to drink, this is going to be your, it may lead to say several vomitings, okay, so vomiting, nausea. It will give the unpleasant smell also. It will give the unpleasant smells, okay, now so that's what. First of all, you have to take the permission from the patient. If he okay, then you have to give the diazepam, okay, now so. And also there is a skin flushing also, okay, there is a skin flushing also, so you have to be take care about that one. That's why you have to ask the permission. So what are other drugs whenever a patient drink alcohol, and what drugs are must be avoided in order to it causes the same disulfiram like reactions? Example: metronidazole, sulfotentin, sulfomanidol, procarbazine, and also the glycofulmin, glycofulmin, okay, na? So these are the drugs you must avoid it after drinking, okay, na? Make sure that you are not taking these drugs after drinking. If you take these drugs, it will cause the disulfiram like reactions, okay. Next one here, there are side effects. So alkalizing agents, example cyclophosphamide. Side effect is the hemorrhagic cyst. For the hemorrhagic cyst, we are using the mesna injection, okay, na? Next, busulfan. The busulfan, what is the side effect? It is the lung fibrosis. There are many drugs which causes the pulmonary fibrosis. Please try to take note. You know, please try to Google that one. Drugs which we are mnemonic for remember. What are the drugs causing the pulmonary fibrosis? Okay, please take note. Antimetabolites, folate antagonists. This is a DFHR inhibitor. Example: methotrexate, which is a mylotoxide. You have to know that one. While giving the methotrexate, you have to monitor everything, because it will causes the megaloblastic anemia, hepatotoxicity, and dysuria. Antibiotic, everyone knows that one. Fluoroquinolones, which is the dirose DNA garage inhibitors, is for the treatment of UTI. It may okay, UTI. If you give this drug in below 6 years children, and below 6 year children, and 70 years old people, then it will lead to the tendinitis. Okay, it will the tendinitis in children's and in the old age. Coming to the tetracycle, I think you will know this one. This is going to be your female. It causes the yellow color tooth and the skeletal defect. So these are some important one. So these are here are some important side effects you have to monitor. You have to do. Okay. Then next one coming here now. Everyone's favorite is the this one cholecystitis. Most common cause is there is a gallstone. Okay, there is a gallstone. Okay, na, and there is a Murphy sign whenever the patient is to cough, to take the breathe. Okay, na, then what happens? There is going to be what? This is the Murphy sign positive. If he get the if he get the pain. Okay, na. Next one, what is the gold standard? It is the HIDA scan for that one for cholecystitis. Okay, na. And also here is the what is the treatment here? You have to do the cholecystectomy. Okay, na. First of all, you have to manage with the antibiotics. Then after that, you have to do the cholecystectomy. That is it's very easy. Okay, na. Then here is the your CDH congenital diaphragmatic hernia. इसमें क्या होता है? ठीक है, हर्निया क्या होता है? सब कुछ क्या होता है? थोरैक्स में जाता है. क्या सब कुछ थोरैक्स में जाता है. ठीक है, तो थोरैक्स में जाएगा तो it will see all bubbles here in the thorax. Okay, na? So this is first of all you have to do the chest X-ray. You will see the bowel loops, shadows in thorax. Bowel loops, shadows in thorax. First of all you have to do the chest X-ray. Okay, na? It is occurred because of there is a defect in the pleural peritoneal membrane. Triad must be what? Respiratory distress. Dextrocardia means what? Dextrocardia means what? Dextro means right side. Means heart will present the right side. There is a scaphoid abdomen. First time you have to do the chest X-ray. You will see the bowel loops in the thorax. What is the treatment here? Close the defect after reducing the. You have to close the defect after reducing the herniated organs here. Bag and mass is always contraindicated here in case. Okay, na? Common cause of death is the pulmonary hyperplasia. Remember, there is a botched leg hernia and a morgagni. If it is present at the right side, meaning so it what side right? This is the so okay. So this is the right side. Okay, this is the right side. This is the left side. Okay, this is the right side. Okay. This is my right side. Okay, this is going to be left side. Okay, na? This is left side. This is right side. Okay, na? So tell me what type of hernia it is. Right side. Okay, na? Then it is going to be what? It is going to be morgagni hernia. Okay, na? Among this one, most common is the botched leg hernia. Okay, just remember this one. Next one, I think everyone knows about it. So what is cholangitis? There is a biliary tract infection. There is a charcot trunk. Pain, fever, jaundice, pain, fever, jaundice, pain, fever, jaundice, pain, fever, jaundice, pain, fever, jaundice. The Charcot triad. There is a renal pentad, means pain, fever, jaundice plus hypotension, and there is a mental status changes in the severe cases. This is the renal pentad. Okay, now just know about this one. And there is next one is this one PSC. PSC is very important. That is it is the main thing you have to remember about the primary sclerosing cholangitis. It is associated with what ulcerative colitis. Associated with the ulcerative colitis. What is the primary sclerosing? What there is a hardening. There is a hardening of the what bile duct. That's why it will lead to easily strictures. Okay, na? It is strongly associated with what ulcerative colitis. Okay. Then just do the diagnosis and the management here. Okay. It's the Urca you have to give. Urca means what? Ursodeoxycholic acid to slow the progression. Done. This is going to be a Hirschsprung. Hirschsprung, there is a what? There is a lack of what? There is a congenital megacolon, lack of ganglionic cells here. Ganglionic cells are enteric nerve plexus. That's why there is a failure of neuroplast of cell migration, which is that's why there is what happened, there is no contraction. That's why there is no contraction. That's why there is the patient will fail to pass the meconium. Okay, now what there is a lack of ganglion cells. Okay, na cells वहां पर develop नहीं होता है. It is always associated with what Down syndrome. The most common site is the rectosigmoid. The rectosigmoid chief complaints are very important. The bilious emesis, abdominal distension, failure to pass the meconium within 48 hours. Within 48 hours. Okay, now investment of choice. What am I? There is a full thickness section rectal biopsy. You will see there is a absence of ganglion cells. Surgery. What is surgery? Amma? Duhalem's operation. That is the resection. Remember here, out of the all the esophageal atresia, which is the most common type is the C. C is the most common type. C for common, C for type. Type C is the most common type. Remember here that this is a vectoral disease. Vectoral disease what? A vectoral disease. A for what? Amma? Remember vertebral. Okay, now vertebral. A for V for vertebral, anodactyl, cardiac, fistula, relations. Okay, among this all most commonly is the cardiac. Okay, there is a restriction of pain, burning due to transient frequency LALS relaxation. What's the innovation of choice? The gold standard is the 24 hours ambulatory pH monitoring. Sorry, this is done. Okay, for the GERD. Okay, GERD. Okay, for the GERD, there is a everyone knows that it is going to be causes the burn pain. Okay, due to what frequent lower esophageal sphincter relaxation. What is the international choice is going to be a gold standard is the 24 hours ambulatory pH monitoring. This is the one question. Okay, na? Biopsy what, amma? And also you have to do the upper GI endoscopy plus biopsy. Surgery is important. This is the Nissan's fundal application. The most common complication is the esophagitis. Everything is important here in the GERD. Okay, na? Due to what? LES relaxation, one MCQ. Gold standard 24 hours ambulatory pH monitoring. Surgery important, complication important. Okay. Next one, Jenkins diverticulum or a pharyngeal pouch. It is a false word. This is a false diverticulum, which is true. Meckel's diverticulum. Okay, na? Here what happened, amma? There is a esophageal dysmotility causes the herniation of what? Muscles between what, amma? Mucosal tissue between the what, amma? Thyropharyngeal and a cricopharyngeal part of the inferior pharyngeal constrictor, which is called as Killian's, which is called as Killian Dyson's. It's also called as Killian Dyson's or Killian's triangle between what, T and C, thyropharyngeal and cricopharyngeal part of the what, inferior pharyngeal constrictor. Now, there is a symptom will be dysphagia to the solid. Dysphagia to the solid. Okay, na? There is obstruction, gurgling, aspiration. Okay, na? Most common in the older males. Next is achalasia cardia. You know this is failure to the relaxation of the LES due to absence of ganglion cells in the absence of what? Ganglion cells in the aura batch in the myotic plexus. So the deficiency of and also there is a deficiency of the nitric oxides. The criteria we'll use is the Chicago. We'll use the Chicago criteria. There is symptoms like regurgitation, dysphagia to liquid here. This is dysphagia to solid where in the Jenkins diverticulum, for liquid it's going to be achalasia cardia. Instrument of choice is going to be esophageal manometry. Diagnosis will be barium swallow. On barium swallow we'll say the bird's beak sign, and the surgery is going to be the Heller's myotomy. Okay, remember this point. Next, CHPS. This is a congenital hypertrophic pyloric stenosis. Okay, they will give you that a pregnant woman who take the erythromycin during pregnancy and she is having these symptoms means just remember that why this guy is mentioning erythromycin in pregnancy. So you have to know, okay, he was talking about the congenital hypertrophic pyloric stenosis. Okay, erythromycin intake during pregnancy, it causes this one. There is a projectile non-bilious vomiting due to what? Hypertrophied pylorus, due to that one. So HCl will be thrown out. Then you list what, amma? When there is acid, will throw out. What's remaining? Alkalosis. There is going to be alkalosis. alkalosis, there is a hypochloremia, hypernatremia, paradoxical aciduria, and the treatment will be what? Ramstead pylaromyotomy. Okay, okay, got it, got it. These are important one. Next one, intussusception. What is the intussusception? There is a what coiling. There is a telescoping. Okay, na? There is a telescoping of a proximal bowel segment into distal segment. Proximal into distal segment, mostly common at the ileocecal junction. This is important. Seen in infants, usually idiopathy in children, less frequently due to an identified late point. Wait upon. Okay. Infection, mostly common to adenovirus. This is, they are not going to ask this one. Okay, leave this one. Okay. See here. What the most common chief complaint is the vomiting. There is a red current jelly stool. Red current jelly stool. They will mention this point in the question. You have to tell, okay, this guy was asking about intussusception. Okay, now, so where do you find the red current jelly sputum? You will see in the case of what? Klebsiella pneumonia. There is on examination, there is a saw-shaped lump and a signs of damps. We'll see on the examinations. And guys, we'll see the on the initial X-ray abdomen. Very end, we will see the watermark, class sign, and a coiled spring sign. On the ultrasound, we'll see this on CCT. There is a target and a donut sign. There is a pseudo kidney sign here. Okay, this is the red current jelly stool. Okay, this is the what? Cork sign here. This is going to be class sign here. This is the class sign on the okay X-ray here. You will see that this is donut sign. This is our target sign here. Okay, now management will be what? Contact enema. So you have to insert the air in the via the what buttocks, so that what happened, whatever it telescoping is going to what going to be come into the normal. There is going to reduction. Okay, it will come to the normal places. Okay, the indication surgery, the recurrent resuscitation, perforation and strangulation. Surgery is the what? Resection and the anastomosis. Done. It's very easy. Next one is the Metcalfe's diverticulum. It is the true diverticulum. True diverticulum. There is a outpouching from the bowel due to partial persistence of the waterma vitellointestinal duct, called as omphalomycentric here. The most common congenital anomaly of a GI tract can cause hematochezia melena, which is the and also having the right lower quadrant pain also. Okay. Oh my gosh, what I'm talking about that one. Okay, I will talk only the exam point of view. Okay, now see. First of all, this is the important vitellointestinal duct. Okay. Next one, they will ask you the two rules. Okay, now the rules of twos. It is remember 2 times likely in male. 2 times likely in male. Okay, now they will ask 2 times likely in female. Oh no, wrong. 2-inch long, 2 centimeter long, 2 meters long. No, 2-inch long. 2 feet from the ileocecal wall. 2 centimeter. No, it's 2 feet from the ileocecal wall. 2% population commonly present in the 2 second year of life may have two types of epithelia. Mostly the what? Gastric type. Okay, gastric mucosa. Okay, next one. Chief complaint will be what? Asymptomatic. Okay, na? Most common presentation is what? Bleeding per rectum, pain due to Meckel's diverticulitis. Okay, na? Which may mimics the appendicitis. There is a risk of perforation. What is the diagnosis here? Enough choice is the remember here 99 what? Technetium, particinate. Okay, na? Particinate scan. This is the scan number. Okay, na? This is the scan. This is also called as Meckel scan for uptake by heterotrophic gastromycosa. Okay, now this is very important. They will ask you what is the investment of choice for this one. Okay, what is the treatment? white mouth and base, and just leave it. And if we not about mouth and base, we have to do the diverticulectomy. Most common complication is going to be what? Perforation peritonitis. How to do the dissection and the anastomosis. Okay, next one. Volvulus. Volvulus, there is a twisting of the what? Twisting of portion of bowel around is the mesentery. Okay, so that it will look like what? It's going to be a mega colon, and it is going to look like a coffee bean shape. What am I? Coffee bean shape. It is going to look like the what? Coffee bean shape. Remember, just this image important. The image is important. Okay, na? On the midgut. Okay, this is midgut volvulus. Okay, na midgut volvulus more common in infant children. Sigmoid volvulus is common. See, midgut volvulus is more common in infants and children, but sigmoid volvulus is more common in adults. Okay, na? Okay, na? Sigmoid is more volvulus is more common in. Okay, na? You have to don't remember this midgut. Remember the sigmoid. Okay, na? Remember the sigmoid volvulus. It is the coffee bean shape on the X-ray, and upon barium enema, it shows the bird beak sign. Yeah. Remember, upon barium enema, it will shows the upon barium swallow, it shows the what? Bird beak sign where? In the clexicardia. But here on barium enema, it shows the bird beak sign, which is seen in the sigmoid volvulus. Okay, remember sigmoid volvulus, hot shape, coffee bean shape. That's it. Next, acute or chronic gastritis. Just remember this one. Remember that there is a burns where see the curling ulcer. See, these are very important. Curling ulcer due to the gastric ulcer causes what? Hyper, causes the hypovolemia, and it's going to mucosal ischemia. This is a Cushing ulcer. There is a it is due to what? Due to increased ICT, increased curling ulcer as a Cushing ulcer. Okay, na? Cushing ulcer due to the it is ulcer due to what? There is what do you call that one? ICT increase the intercalated pressure. Okay, na? Burning ulcers. This is burns. This is the curling ulcer. It's going to be whatever in the in the mucosal, gastric mucosal. Okay, that's it. Next one, see here, this is the gastric and the duodenal ulcer. You have to remember the differences. The main difference is the which is pain is relieved by what? We see duodenum. It is pain which is going to be relieved, but pain is going to increase by the gastric ulcers. Okay, na? So what is the most common site? Remember, this is lesser curvature. This is the T1 part of the duodenal. And this is the, and also remember here which is the bleeding site. Most common gastric ulcer is the left gastric artery. Common duodenum is the most common is the gastroduodenal artery. Pain relieved by more food. Pain relieved by pain will be relieved after taking the food, but pain relieved by after taking the food. Pain will increase by food. Perforation, what? Anterior peritonitis most common here. This is what we have to do. Okay, na? Remember here there is going single bubble sign, double bubble sign, and triple bubble sign. Everyone knows about this one. Okay, just leave it. Next one, the Crohn's disease versus ulcerative colitis. Crohn's versus ulcerative colitis. I think everyone knows about it one. Okay, na? So no, I think no need any explanation. But I will tell one thing. The main important. So okay, see here ulcerative colitis most involves the watama. It is the continuous, it is the continuous colonic lesions. Always at the watama rectosigmoid. But Crohn's disease water at any points. Okay, Crohn's will affect at the any points. Any points, usually at the terminal ileum and colon. Terminal ileum and the colon. See here, this is the Crohn's disease and the ulcerative colitis. See how it look like. It look like a lead pipe now. it will look like what lead pipe appearance. This is the lead pipe appearance. So it is seen in the case of the what see in the case, this is the appearance is the lead pipe. So it is the okay, loss of astra. It look like the lead pipe appearance in the case of the what ulcerative colitis. But here see it's a what this is the cobblestone. This is the cobblestone appearance in the Qur'an. C for cobblestone, C for Qur'ans. Seen in the cobblestone, seen in the case of the Qur'an. These are the main important one. And remember here, remember which is the smoking protective, which is the ulcerative colitis protective. Okay. Investigations. See here, and that's it. Treatment you have to remember. Drug of choices for the corticoids, azathiopyrin is important here. But you have to know the which these are the only they are going to ask the which part is going to affect it, and the symptoms are very important, and these images. Okay. Next one coming here, coming to the myopia, hypermetropia, astigmatism here. So you have to, they are going to give the images there. You have to remember the light falls in front of the retina. Okay, light will form the water in front of the retina only. Lights, they are not going to the lights are not crossing the retina. It will going to fall behind the in front of the retina only. That's why we are getting the myopia. So we have to correct. Okay, now we have to correct by the concave lens. So the light will focus at the what? It will reach to the retina. See here. So how they are going to test her in the examination? They are going to start with the question. The question they will see is that okay, Ajay, a 25-year-old guy, he was squeezing his eyes to see the objects. He was squeezing eyes to see the objects are blackboards, and these are the findings. It means they are asking about the myopia. Okay, now. So if they are going to give this image, you have to take okay, meaning they are going to this is the correction of the myopia. Okay, they are correcting the okay, they are correcting the what, amma? Yeah, they are correcting. Wait. Yeah, see here, see here. Okay, see here, light is not reaching to the retina. It's falling only in front of the retina. Here we will correcting the so light will fall on the what retina. Next one is the hypermetropia. Hypermetropia, whatever here, light will falls behind the retina. See here, light will falls behind the retina. See, behind the retina, okay, na? It must be here, but light will fall in what, Rama? Behind the retina. Behind the retina, it here falling here. Okay, this is the hypermetropia. This is the hypermetropia. So that's why we are correcting with the convex lenses. Here they will give the there is a asthenopia. That meaning he was rubbing his eyes. He was rubbing his eyes. Okay, he was rubbing his eyes to see the objects. Okay, he was to see the objects. Okay. Next one, astigmatism. Astigmatism, what there is a more rays are coming on the what retina. There are many rays coming to the retina here. In this time, we are having the simple hypertrophic, but don't worry. Just remember the only the okay. Many rays are coming on the retina. Light rays do not focus at one single angle. We have to use the torical cylindrical lenses. So if you know these two guys, this is going to be going to be very easy. Okay, you have to roll out. This is the retinoblastoma. Retinoblastoma. There is a blastoma. Okay, na? Okay, now there is they will ask you guys what is the chemotherapy. Most common is the what? Most common is the here leukocoria. It is the skin symptom is the leukocoria. White pupil here. Okay, now. Gene is the automa, is the RB gene. This is the what hypothesis, Knudsen 2 hits hypothesis, chromosome 13q14. What is the chemo here? We are using what chemotherapy? VEC means VEC means vincristine, E for etoposide, and this is the not carboplastin. This is the not carboplastin. This is the carboplatin. This is carboplatin here. On your microbiology, you see this is the flexor ventestine rosette here. Remember, this is the congenital glaucoma. This is called a ophthalmos. Okay, this is the Ophthalmos. They will give this image and they'll say there is a blepharoplasm and there is a photophobia and the lacrimation and they will give this one. Then you have to, this is going to be the ophthalmos. Okay, na? Same question. Surgery of choice for the congenital glaucoma with the clear cornea is going to be goniotomy. Surgery of choice for congenital glaucoma with the hazy cornea is going to be the trabeculotomy. Okay. Remember, this is your task of na every time in the Fmge examination, guys, they are going to ask the questions from here only. Questions from here only. Questions from here only. Please remember, please master this one. Okay, here is the answer. Please, if you can't do this, I will feel very sad. Please, at least do this. At least master these images, please, okay, na? Please master this. Okay, done. This is your job to master all these images. I don't want to see anything. I don't want to hear anything. At least, guys, there are only how much? एक दो तीन चार पाँच छः only up to 25 images are only there. Please mark one. This is what pterygium. Pterygium is what? Conjunctiva and the cornea. Conjunctiva and cornea. Conjunctiva is going to sit on the cornea. Conjunctiva is going to sit on the cornea. This is pterygium. Most common mirror effect is the astigmatism. What is that? How we are going to treat? You have to do the you have to do the excision and you have to do the cornea graft. Okay. And simple. This is the PDR non-pro. This is a proliferative. Means proliferative waterma, there is going to be a new wedges formation here. NPDR, there is a accident here. CRVO, there is a tomato flash here. Tomato flash appearance. CRVO waterma, this is going to be waterma. CRVO, this is a arterial retinal artery obstruction. If there is an artery obstruction, there is waterma, there is going to be there is a waterma, there is a everything is going to be water. There is a cherry red spots. Okay, there is a cherry spots. We'll see that one here. If there is a blockage of the blockage of the artery, what is going to happen? The whole blood supply will stop. It's going to be a cherry red spots. We'll see that one. Here we'll see the spicules here. This is chalagen clamp here. This is the iridodalis means iris going to form like a D shape. This is most common during the cataract surgery, but it's okay. It's going to normal. Chalagen, painless. Sty, painful. Ophthalmia, neonatal. Trachoma, this is a sago grains. Okay, it's a tonometer for the checking the IOC, intraocular pressure. Okay, so like this one, see here, many things here. Next one, a gunshot case brought for autopsy shows a round entry. What is a round entry wound with inverted margins. Margins are inverted, surrounded by tattooing, birching, staining. See here, burning and singeing of face is not noted. So here only there is going to be round entry, and meaning here burning and singeing is not present. So there is a see SBT means S means singeing and burning not present. Meaning what this is going to be near shot. In near shot only tattooing is present. So it's going to be what only tattoo is present. When tattoo is present, but there is no burning and singeing, is going to be your near shot. Please always see the question of what they're asking. If they give that they just still, let's say, elevated largest means everyone knows okay in the contact only there is going to be a stellate shape wound close All present. Close, all present. Yes, singeing, burning, tattooing will be present. Near only tattoo is present. Distant there is a contusion, abrasion, graces, and sure exit on. Everything is present. Okay, so this is the key point to remember. Everyone knows about this one. This is associated with the in situ decision, which is the autopsy. See here, this is the here. This is the Lentulus removing enmass altogether. Virchow method, organs removed by one. This is the most common type. Gons means what? This is gons means block by block we remove. Rocket tank C. Virchow V for one, V for one. Okay na? V for remember demonic is one. Means one by one. We have to remember the one by one. Gons complex means block C, block by block. Lectures removing enmass altogether. Rocket tank C means what? There's infections periods like COVID. So that's why you have to do not open all the body, all the tissue, but you have to do the dissection just from inside only. Okay, na? No need to cut everything. Just do the from the inside only. No need to open all everything. Okay, yeah. So this is the most common. This is the finger. Okay, finger types here. Okay, yeah. Okay, fingerprint. This is the loop lock. You know, this is the loop like pattern. This is the most common type. With me. Let's do fingerprint and you have to identify. Something happened with my system. Okay. So okay, the next one is this is the types of incisions. So this is the inverted Y. This is the I-shaped. This is the Y-shaped. This is the modified Y-shaped. Okay, na? Inverted Y-shaped we will do in the way Y-shaped here. Inverted Y-shaped we will do in the case of what in the case of the fetal death. Okay, na? X-shaped incision will do in the what at the custodial death. Where in the custodial death. Modified Y-shaped we will do it at what at the case of the asphyxis. At the case of the asphyxia. Okay, this is I-shaped, Y-shaped here, below Y-shaped here. This is the I-shaped here. This is the modified. From the neck we have to do this is modified Y-shaped. Okay, they will give you the images and you have to identify, or else they will ask you this like a one-liner. Okay, there is a fetal death and what type of incision are going to do. It's inverted Y-shaped. Yes, in the custody, the X-shaped. In the asphyxia cases, I think you know the case of the Sushant Singh who dead who died because of the asphyxia. So he have to in the postmortem they have to do the modified Y-shaped incision. Next one, the thermal burns here. Thermal burns are, see, I will try to send one video in the group. Try to check the thermal burns there. It's going to be very easy. And they're going to ask the question from always one question from here. Actions of thermal burns is you have to test the TBS say total body surface area. So there is a rule of 9. I think everyone knows about that one rule of 9. There is a head and neck 9%, each limb 9%, 9%. Okay, na 9%, and there is a limb 18%. Okay, na 9, 18, and the trunk 18, posterior trunk 18, perineum is going to be 1%. So meaning you have to calculate the total body surface area. Okay, na? Okay, na? There is going to be a case scenario. Okay, na? So for example, a patient got like injured by thermal injury. He got the injury. He got the burn at the thigh or at the arm, meaning you have to take down like how much percentage is the burn, so that by that percentage gas you have to do the what fluids you have to do the fluid resuscitation. You have to do the fluid resuscitation, that is called what formula, that is the Parkland formula. That is the Parkland formula. What is the formula? It's the 4 ml into body weight in kgs into total body surface. So this is going to be a total fluid requirement. Suppose example is, so this is a 4 ml is common, plus body weight into body weight, example is 50 kgs. Okay, and the total body surface is going to be 36%. So this is the total fluid requirement. So can I first of all give 50% in the first 8 hours and remaining 50% in the next 8 hours. Use only Ringer's lactose solution and adjust based on the urine output. See, very simple here. Why we are going to calculate these TBS, total body surface? Because to know the how much fluid he have to require depends on the total body surface area which is going to injure during the burn. Okay, this is how they are going to ask the questions. Please see it carefully. Okay, now. So in the arm, forearm, and hand, there's going to be the 2% here. Meaning, guys, there's total 9 kada. 2 do the char. See here, total 9 kada. So there's a 2% here. 1.5, 1.5, order 2%, 2, 3. 1, 2, 3, 4, 5. Okay. See here, this is going to 2%, meaning 1 anterior, 1 posterior. Here also 1.5, meaning half of. Okay, na? 1.5, how much is the, okay, na? 1.5 is anterior, okay, na? Meaning half of the 1.5 is the anterior and the posterior. So, okay, na? This is how you have to divide this one. Okay, na? Okay, done. Don't worry, I will send one question in our group and you have to solve that one. Next one, depth of the burn. Okay, here the depth of burn here by the question you have to they will give the symptoms and you have to identify they will give the symptoms and you have to identify the types of burn. Depends on, okay, na? First of all, burns are depends on the depth, okay, na? Depth of burn injury, okay, na? Depth of burn injuries, okay, here first degree burn, which is a superficial burn, it involves only epidermis areas only. So what is the features? Redness, pain, dry skin, no blisters. No blister because it's going to only epidermis. Healing within 3 to 7 days without scaring. Okay, example, sunburn. Second degree, partial thickness burn. Involves epidermis and the part of the dermis. Okay. In these two subtypes, superficial partial thickness and deep partial thickness. Okay, na? In this one, so it's going in the superficial SPT, there's going to be a blister. Healing within 10 to 14 days, but there's a minimal scaring. The deep partial thickness. So there is a watama pale. Obviously, it's going to be pale, painful, and the reduced sensation because of watama there is a injury to the watama nose. That's why it may take 3 to 6 weeks to heal the scaring. Third degree watama, full thickness burn. The entire epidermis will be involved. Clinical features: white, leathery, charm, painless due to watama nerve destruction. Requires surgical intervention, skin grafting. Fourth degree, this is one. Okay, now this is how they will give the symptoms and you have to identify that. So these are some important poisonings and antidotes. So all the poisonings I made separate videos. Please try to go through it and have it. Okay. So these are the main one. So this is the anatomical snuff box. This is the anatomical snuff box. Why it is called snuff means in ancient time what happened, guys? They will put the here morphine here. They will sniff. That's why it is called as anatomical snuff box. Okay. So just take out your snuff box here and tell me okay, this is the lateral side, this is the medial side. Lateral side, medial side. Okay, now what is lateral side? There is the abductor pollicis is longer, and there is the extension pollicis. What is pollicis? Thumb. Longest means long, brain means what? Small. This is going to be your What am I? Left side abductor. What is, see why we are doing the abduct? This is the adduction. This is the abduction. So we put like this one. Right? This is going to be our what part lateral part of this one. So this is the what? This is the longest one. This is the abductor. It is the not adduction. This is the abduction. This is the abductor pollicis is thumb. Abductor pollicis longest and the extension pollicis brevis. See here. Medial watama, medially there is no abduction, there is a extension. Watama, pollicis longus. Roof is cephalic vein, content is a radial nerve. That's it. This is the watama posterior tibial artery. He was palpitating, and you have to. They will sometimes they are going to ask the questions that they will mark what is this, what is this, what is the gallbladder, liver, stomach. This is what you have to. This is what you have to label on the CT. Sometimes also they are going to ask, they are going to give these images of your wrist and the foot, and you have to identify what are the bones. Okay, so bones are very important. This is the ulna, this is the radius. Okay, now some says she looks too pretty. She looks means scaphoid, lunate, trichotrium, and a PG form. She looks too pretty. Try to catch her. Try to catch her. Try means what is it? Trapezium. First of all, you have to visit the gym, then join. This is trapezium, trapezia. This is the hamate. This one also raw. This is the TNM. This is for the talus, navicular, and the calcaneum. TNM, medial cunicum. This is the C. This is the TNM. TNM meaning this is the talus. This is the what one navicular. This is going to be medial cuneiform. Okay, now this is going to be what medial intermediate. This is lateral cuneiform. See, very simple, raw. This is applied by why this is applied by what deep perennial nerve. This is a deep perennial nerve. Next one, again stuck. Next, so again stuck అయిపోయింది.